This is Harley, a 2-year-old beagle that we've trained to sniff out C. diff in the hospital.
C. diff is short for Clostridium or Clostridioides difficile. It's very hard to get rid of, and it produces different toxins that cause mild diarrhea all the way up to severe diarrhea, and particularly in elderly patients can be fatal. We found it on patients' shoes, objects such as bed rails, doorknobs, and it could last for literally months. There was a paper that came out from the Netherlands that described a dog was trained to sniff C. diff, and my thought is that if they can teach a dog to sniff C. diff in the Netherlands, we should have somebody in this country that can do the same.
We train pointing dogs, retrieving dogs, and flushing dogs, and we obedience train everything, so we never considered that we would be in a hospital trailing out C. diff from room to room. Beagles are good for this because their smelling ability is 300 times stronger than ours.
When Harley comes up to an area where she detects C. diff, she sits next to that area. We'll use usually bleach agents to clean it. Recently we found the ultrasound machine has 3 probes that are basically applied to patients' chests looking at their heart function, and we found C. diff on one of those. The recommended cleaning of the probe included an agent that actually doesn't eradicate C. diff.
So we began investigating how we could clean the machine to kill the C. diff spores. We found ways to do it, and we instituted a policy with our medical director to clean the machine the appropriate way to kill the C. diff spores. And we would have never really thought about it if it hadn't been for Harley coming up and showing us the way.
What we're planning on doing is having Harley go into the rooms after they've been cleaned to make sure that they've eradicated all the spores. Harley might get jealous, but depending on the success here, I suspect other hospitals will probably be doing the same soon.